Placebo and Homeostasis. A presentation by Professor Gershom Zaitchik, Faculty of Medicine, Hebrew University of Jerusalem. I suggest that before listening to the entire topic, please listen to videos on placebo which I published, and I shall describe these videos first. So we start with placebo activates a biochemical process, and this video describes experiments based on conditioning. Then come our placebo effect, its biomedical foundation, chapter 1. And this is mainly the chapter which I would like you to listen in order to understand the discussion on homeostasis. So it describes placebo treatment is a clinical intervention intended to benefit the patient. Its physiological mechanism is unknown. Medicine distinguishes between two kinds of treatments, curative and palliative. This chapter 1 describes also a clinical trial which I shall analyze in terms of homeostasis. And this clinical trial had this outcome. Drug treatment got 60% of patients where ulcer was healed. Placebo pill, 50% ulcer healed, and no treatment, 10% ulcer healed. So medicine distinguishes between two kinds of processes, explained by the theory and unexplained. And we realize that the theory of medicine lacks concepts and arguments to explain the peptic ulcer phenomenon in group 2 and 3. And therefore, the theory of medicine is incomplete. There is the placebo effect, chapter 2, and it deals about with mind and verb, and I suggest you listen also to it. And the last chapter, placebo effect, chapter 3, actually describes placebo therapy, which is also relevant to our topic. So we ask, what is homeostasis? And I described homeostasis in a video, and here is the link, and we define homeostasis as a self-regulating complex system by which an organism maintains stability and maximal optimality. So here it is, medicine discussed as curative and placebo treatment, but no matter what you do, any treatment interacts with the entire homeostasis. And now if we go back to our peptic ulcer therapy, again, everything which I discuss is, we are talking about the entire homeostasis, and we see here the drug therapy and placebo therapy interacts with the entire homeostasis, and we also realize that if we don't treat homeostasis, we have also a 10% effect. So, conclusion, homeostasis is an invisible ally of the great medicine. More to come. Enjoy.